A new study by a UW-Madison professor found that COVID-19 caused an alarming surge in premature births, but COVID vaccines were a big part in lowering the early birth rate to pre-pandemic levels.
Our Catherine Merck spoke with the professor about what this means for vaccinations for those who are expecting. Catherine?
The study looked at births before and after the pandemic, and while the findings are new, the message remains the same about vaccinations.
You know, we have every reason to believe that vaccines are safe in pregnancy. All of the evidence suggests that.
We've heard this before. Vaccinations are safe. But a new study shows that not getting your COVID shot can have even more consequences for babies.
There are costs to the fetus of avoiding vaccination.
A new study with findings published partly by UW-Madison professor Jenna Nobles found that COVID-19 caused an alarming surge in premature births. However, vaccines were key to returning the early birth rate to pre-pandemic levels. The team compared siblings who were born before the pandemic and those who were born after.
It seems that the population immunity conferred both from people's exposure to the virus, in fact, people had cases of COVID, but also because of vaccination was extremely protective against the risk of having COVID on pregnancy outcomes.
This professor says the research makes a compelling argument in favor of getting vaccinations and boosters. So while this study is brand new, she says it leads to the same message doctors have been saying all along.
Vaccination for people thinking about getting pregnant and for people who are pregnant is a good idea.
Preterm birth is associated with many short and long-term health problems and deficiencies for children and their families. It's the leading contributor to infant mortality, and cutting short development in the womb can require additional medical attention that costs are an average of more than $80,000 per child. That makes these findings of this study even more important for families.